A quick internet search will make you think that there are many cures out there for diabetes. Everything from nopal to moringa leaves have been sold as cures for diabetes, but let's see what the data has to say. Research on type 2 diabetes reversal has largely focused on three areas: calorie-restricted diets, low-carbohydrate diets, and surgical interventions. Let's start with calorie-restricted diets. Low-calorie diets have been studied as a cure for diabetes since the 1970s, with positive results including lower blood sugar levels, improved insulin resistance, and reduced medication use. The benefits of low-calorie diets are mediated largely by weight loss, which is important to note because in the long term, a majority of the study subjects were not able to keep the weight off. And this is not their fault. In these studies, weight loss was achieved by reducing caloric intake to less than 1,000 kilocalories a day, which is less than what a 4-year-old child needs to eat in an entire day. So it's no surprise that people found it hard to eat this way for more than a few months. In terms of effectiveness, study results vary. In some cases, just 2 to 10% of study participants were found to remain in remission after 1 to 4 years of following a calorie-restricted diet, while other studies have shown a 46% remission rate after 1 year. Still, 600 to 900 calories a day may reduce type 2 diabetes symptoms in the short term, but potentially create more long-term problems associated with not getting enough micronutrients down the line. Another potential consequence is rebound weight gain, which is always a concern after severe calorie restriction. Now, because we don't have any long-term studies looking at the effects of very low-calorie diets in people with diabetes, it's hard to say if this is a remedy or just a short-term solution that could produce problems later on down the line. Topic 2: low-carbohydrate diets. This is the quintessential diabetes treatment. When most people think of diabetes, they think of sugar and carbohydrates, and with good reason. Reducing carbohydrate intake was the main approach to managing diabetes before insulin was discovered in the early 1900s. Instead of severely reducing energy intake, these diets target intake of carbohydrates, limiting intake to less than 130 grams per day. Such diets are considered standard for diabetes management. Researchers assessing the possibility of achieving diabetes reversal, however, not simply management, usually aim to reduce carbohydrates to the point of forcing the body into ketosis. This is a state where the body switches from glucose as its main energy source to fat, and ketones are the byproduct of this transition. To achieve this, carbohydrate intake has to be really low, like 20 to 30 grams in a day, which is about 2 servings of carbohydrates. So just one bowl of cereal would send you over that limit for the whole day. Nevertheless, researchers have found positive results with this approach. Lowered A1C, body weight, medication use, and insulin have all been observed after a minimum of 6 months in 55 to 95% of patients. Still, follow-up studies beyond the 2-year mark are lacking, and without such studies, it is hard to know if these benefits are sustainable. Topic 3: surgical interventions. Bariatric surgery is an evidence-backed way to improve blood sugar levels very quickly, even within a matter of hours. Common options include the sleeve gastrectomy and the roux-en-y gastric bypass. These surgeries are indicated for people with diabetes who are at a body mass index or BMI of 40 or higher, or for those who are at a BMI between 35 and 40 with at least 2 conditions related to carrying excess weight on their bodies. While these procedures are considered safe, any type of surgery will of course entail some risk and steep financial costs. Short-term studies are promising, but in the long term, after a decade or two, the effectiveness of the surgery may decline. Studies suggest that 20 to 80% of patients remain in a state of improved diabetes symptoms 5 to 10 years after surgery. Now, 20 to 80% is a pretty wide range. This is because how much people benefit from surgery really depends on a number of factors, which I will cover at the end of this video. To answer the question I posed at the start of the video, the most up-to-date research suggests that energy-restricted diets, low-carbohydrate diets, and bariatric surgery are all useful interventions for getting diabetes under control. However, even with these interventions, it is not appropriate to say that diabetes has been reversed or cured. The preferred term is remission. Medically speaking, remission means that the disease remains present, but there are no signs and symptoms of it. Still, there is the possibility of the disease recurring if proper lifestyle and behavioral changes are not kept in place. When someone's diabetes is in remission, that means that they're able to keep their blood sugar within the normal range without having to rely on taking medications every day. How likely someone is to achieve remission depends on a number of factors. Those who are most likely to see their diabetes go into remission are people with a lower BMI, who are relatively young, have never had to use insulin therapy, have high C-peptide levels, which is an indicator of how well your pancreas is producing insulin, and have had diabetes for a short period of time with pretty much no complications. In case this answer was a bit of a downer for you, I want to emphasize that doing the hard work of getting your diabetes under control is still worth it, even if you cannot completely reverse it. Take a look at this graph. As you can see here, all of the available interventions, from dietary changes to surgery, are effective at reducing A1C after 1 year, but that number slowly starts to creep up again after year 2 and year 5. Still, it does stay well below baseline, indicating that the huge amount of effort it takes to get diabetes under control is net beneficial over time. If you have diabetes, make sure to follow your care team's recommendations when it comes to following a diabetes-friendly diet, taking your medications every day, monitoring your blood sugar on a regular basis, and getting regular eye and foot exams. Alright, so that's it for this video. If you learned anything new or think that someone you care about could benefit from this information, then definitely share the video, give it a like so that more people can see it, and subscribe for more nutrition videos. Take care.